As humans, we should all be able to run, crawl, lift, carry, jump, balance, throw, and the topic of this video, ass to grass squat. Welcome back to Movement Project. I'm Tim Rementer, Doctor of Physical Therapy. If you're new to the channel, our mission is to cut out unnecessary surgery and opiate use by focusing on the movement that's at the root of the problem rather than just treating the symptoms themselves. To help me on the mission, please consider subscribing and share this content with anybody you think it might help. Low back pain is at epidemic levels. While many other cultures sit exclusively on the floor and go to the bathroom on the ground, we spend most of our time sitting in chairs along with comfy couches and cars. Another area where we struggle is the use of our entire joint surface. You wouldn't move into a new apartment only to rope off half of the rooms, never to use them again. But this is exactly what we do with our joints, especially our ankles, knees, hips, and low back, by not squatting to depths that use the full range of motion of the joint. Definitely want to give a shout out to Kelly Starrett in the Ready State for giving me this idea with his awesome video on the 10-minute squat test last year. If you haven't checked out any of his content, I put a link for his channel in the video description. He's a super dynamic physical therapist, not to mention a best-selling author. Now there's two main parts to this video. The first is just identifying what your maximum tolerance for the ass to the grass squat test is. And then from there, I'm going to show you how to develop a program to increase that tolerance to a maximum level safely for you, which should also reduce your back pain, hip pain, and knee pain by working on improving that connective tissue strength, spending time at end range for each of those joints. The first piece of business we need to handle is the form for this squat test. When we're doing this squat test, a few things we need to point out. First is the width of our stance, okay? When we're doing this, how wide we go is going to be largely dictated by our anatomy. So if your hip socket is relatively shallow, your leg is going to be able to come up to your chest much easier without going out to the side. If you have a more kind of cup or ball-like hip socket, then you're going to be a little bit more restricted and you're not going to be able to get into this range as easily as I can here, at which point you're going to need to kind of bring your hips out to the side more for this deep squat. Okay, the next piece of business for form is we need to make sure our heels are staying flat for this test. We don't want to be coming up onto our toes. That tells us that we're lacking some mobility and control in the hips, possibly in the ankle, or even in the knees. One area of focus for the squat that I hear so much about is the butt link. Basically, that's when you lose the control of your pelvis and it rotates backwards, or you go into a posterior pelvic tilt. When we're trying to do a powerful squat, especially with load on our back, and we go down, we want to see that we can keep this spine angle. So that point at which this kind of curve here reverses and it drops right there. People will refer to that as a butt link. Now, if you're loaded with a bar and you have compression on your spine, that's definitely something we want to try to avoid. You're going to lose some power and put a lot of stress on your discs. But for the sake of this test, that's okay, and we should actually see that mobility occur. There's a reason that our L4-5 and L5-S1 segments in our back move more than the other segments. They need to be able to take on that extra load from the connection into the pelvis and into the hips. So we do want to have some activities where we stretch that lower lumbar spine. Excess stiffness in the lower lumbar spine is often something that we'll see people coming into our facilities with pain in their lower back and their sacroiliac SI joint. Something you would want to take a look at is when this pelvis rotates. So if it goes way too early in your squat phase, then you know you have some problems with motor control that you need to work on, and you want to try to hold that off a little later in your squat. So filming yourself doing this would be very helpful so you can see the timing of that movement. If you watch my video on getting up from the floor without using your hands, we already know how important it is for our lifespan and our mortality to be able to stand without our hands. The last thing we want to talk about is the rotation of your feet in the position. Now, if you can try to be relatively straight with your feet for this squat test, that's going to be great. But if your anatomy doesn't allow it, it's okay if they just naturally rotate out a bit. Okay, so just kind of do what feels natural, especially when you're starting. You can start to experiment with some different positions as you go on through weeks of this program. Now that we have our form squared away, you're gonna take yourself through a max test. Now you don't wanna be causing any type of significant pain or discomfort. You will feel some stress in different areas of your body. You wanna take note of that. Is it in your lower back? Is it in your hips? Is it in your knees? Is it in your ankles? For me, it's almost always my knees, which are improving as I've done these exercises over the past year, I would say, moving from almost an inability to get in this deep squat position to now I can hang here for minutes on end. Once you establish your time that you can tolerate the position, let's just say that it's 5 minutes, you're gonna follow this program that I'm gonna lay out for you in this video. But Tim, what if I can't do the squat to the floor position at all? No worries, we got you covered. You can just get yourself some dumbbells, you can get a stack of books, you can get yourself some small stools, and then you're just going to unload yourself enough that you feel like you can tolerate doing that for at least 30 seconds. I wanna see your baseline be at least 30 seconds. So you need to unload yourself enough that you can make it through 30 seconds and then keep track of exactly how much you unloaded yourself. How are you gonna do that? Simple, get yourself a household scale. I have a digital scale here. I'll put a link for one in the video description. An analog scale might actually work better because you can see the numbers change instead of this digital scale where the weight will kind of lock out after a few seconds. So I'll just get myself on here. I weigh 182 now. I've been cutting a couple of pounds. All right, and then I'm just gonna unload myself enough, and I'm looking down at the scale, and half of my weight is going to be about 91, and right now I'm about 140, so I'm right around 75% of my weight, and I could stay here for probably 10 minutes or more. So it doesn't take much unloading for you to be able to tolerate the position and then build that up. From there, you're going to just progress through the program I'm about to show you, just like you would if you were all the way on the floor. Only the difference is you want to try to get to 100% of your body weight and then start over. Now that we've identified our safe maximum, we're going to start with our program. It's going to be performed 1 time per day, taking a break on the middle day of the week. So you'll do 3 days on, 1 day off, 3 days on. Your goal is to do 3 sets, starting off with 50% of your maximum safe tolerable time. You're gonna take a 1-minute rest break in between each set, and then you alternate every one of your days from 50% of your maximum tolerable time to 75% of your maximum tolerable time. So if your maximum time is 2 minutes, Monday, you do 1 minute, 3 sets, 1 minute of rest in between. Tuesday, you do 1.5 minutes, 1 minute of rest in between. Wednesday, back to 1 minute, 1 minute of rest in between, off Thursday, and then cycle that through again for your next 3 days. At the end of week 1, you'll retest your maximum so you can adjust it for week 2. When you get into week 2, I want you to do everything the same from week 1 except reduce your rest break to 45 seconds. At the end of week 2, retest your maximum so you can apply that for week 3. Week 3 is the same as level 1 and 2, except we're reducing our rest breaks to 30 seconds. So again, 3 sets, 50, 75% alternating on each day, rest break in the middle, only 30 seconds between sets. Level 4, we're gonna up the ante a little bit using our new maximum safe time, but then we're going to do our 3-day cycle with 90%, 75%, and 50%. Take your 4th day off, repeat the cycle again, test at the end, and you should have seen a significant improvement, at least double or more of your tolerance for being in this ass to grass squat position. To help me on my mission to cut out unnecessary surgeries and opiate use, subscribe to my channel by clicking over here. If you like challenges like this video and want to try a challenge for your push-ups, click down here. Remember, if you want to keep improving, you got to keep it moving.